Welcome back. Nearly 50 million people in the United States suffer from a condition known as tinnitus or tinnitus. Some of you may also know this as ringing in the ears. For about 1 to 2 million people, this condition can actually become debilitating. The Colorado Tinnitus and Hearing Center can help you understand the cause of that ringing and offer you a treatment. Dr. Patty Kalmbach and Dr. Lisa Evans-Smith join us today. Thank you for being here. Like every company that we have on our show and on our website, haystackcolorado.com, we do background checks. So I'm going to let our viewers know what we found out about you and your company. The center was the first clinic in Colorado to begin using a new method of treatment called the Neuromonics tinnitus treatment. The clinic's doctors of audiology specialize in the treatment of tinnitus, and they are both members of the American Academy of Audiology. So all important things to have when you're in this business. Explain to our viewers what tinnitus is and what are some of the causes.
Tinnitus is actually where a person perceives a sound, which there is no external source. So some people describe it as a ringing, a hissing, a buzzing, a roaring. So it's very different for every patient. There are a lot of theories behind the causes. Number one theory, and we know, is noise exposure. So we have a lot of soldiers coming back from Iraq, Afghanistan, coming back with tinnitus. So that being number one, there's also head injury, medications. There could also be an acoustic neuroma on the nerve, a tumor on the nerve. So again, a lot of different causes. The big thing is that whatever the cause, there are still treatments.
And that's my next question, actually. There's a lot of bad information out there. A lot of people think there is no treatment, but in fact there is.
Mm-hmm. That's absolutely right. Unfortunately, so many people are getting told just to learn to live with tinnitus when that doesn't have to be so. The treatments that we use are incredibly effective at getting rid of a patient's tinnitus, at least to a place where it may not be gone, but it's in a place where it's not bothersome to them. We use the Neuromonics tinnitus treatment for that. It is a sound therapy, which the patient listens to about 2 to 4 hours per day. It is designed to decrease a patient's awareness and decrease the tinnitus disturbance that they have. When that happens, the tinnitus goes to a place where they're not really aware that it even exists for the most part. You have to kind of sit and listen to it to find it in many instances.
It retrains the brain to not notice the noise.
It absolutely does.
That's pretty amazing. Let's hear from one of your patients that actually had tinnitus that you were able to treat. It is actually former Congressman Tom Tancredo.
Okay.
One day, around Christmas 3.5 years ago, it came and didn't go away. And it was very loud and very annoying. And the more it stayed, the more upset I got, wondering if it was ever going to go away. After 2 or 3 weeks of it, you are ready to get, go bananas, because it's just, you have trouble sleeping, concentrating. You can't get your mind off of it. It's just always plaguing you, sort of thing. And I must have seen 10 or 15 different people looking for a solution. The device is trying to do is rewire your brain, really, to not pay attention to it. The best thing is that you just begin to forget that's there. Oh my God, my life is so much better than it was, and that's why I hope that if people are having a problem, they'll at least try it.
It's a powerful testimonial. Can you further explain his situation?
Tom, like you said, it started 3 years ago, and since, has gone through treatment and has recently been diagnosed with an acoustic neuroma on the nerve. So he has now begun using the treatment again, had stopped using it. But, he was unfortunately had tinnitus when he was running for president of the United States. So when I talk about stress being a huge trigger, that was a huge trigger for him. But he is doing amazingly better compared to where he was when it first came on. And
you said he's still using the treatment now. He was on it, then he was off, and he's back on it?
He is back on it from time to time, simply because of the acoustic neuroma. But the neat thing about that is that the brain's already been retrained, so when he's using this treatment now, he's just giving himself a little dose to get everything back calmed down again, so that the tinnitus, when it revs up, he can calm it right back down. It will be at the level where it was when he started.
How long was he on it the first time?
About 2.5 years.
About 2.5 years, and again, part of that was the amount of stress that he was under,
Sure.
you know, for running for president. So a little bit longer than the normal patient would have been on it.
Let's listen to what a patient would hear when listening to the Neuromonics device. Yeah, that's very calming. It's interesting because it seems like it's just music.
Yes, very pleasant.
But it's not only is it music, but it's it just retrains the brain. That's amazing that it can do that. What is the one thing that you would want a viewer right now to know if they think they have tinnitus?
I think the big thing is to realize there is hope, like Tom said, that you do not have to live with it. You do not have to have it ruin your life, that there are treatments available.
Well, this is all just great information, and I'm sure that anyone right now that thinks that they have it or know that they have it, they're going to want to contact you. So we're going to give them all of your information, and thank you so much for being here.
For having us.
Thank
Appreciate
you.
it. If you are suffering from a ringing in the ears, call Colorado Tinnitus and Hearing. Call 303-534-0163 or visit the website helpforringing.com. The first 10 people who call and mention Haystack get $25 off the cost of a consultation and $200 towards the cost of treatment. The number again is 303-534-0163. Colorado Tinnitus and Hearing paid for this segment.